Bom dia, boa tarde.
Good morning, good afternoon, good evening to all of you. My name is William de Castro. I'm a researcher, master's degree student at POSAFRO-UFBA, and I'm a curator at the Afro-Digital Museum. I'm here to salute everybody in the second 21st, actually, School of Doctoral Studies, Fabricadeideias, encompassing researchers from Brazil and all over the world. This edition happens every Tuesday and Thursday at 10 a.m. Brasilia time, counting on over 30 professors from different parts of the world. Fábrica de Ideias organizes this event in partnership with the Graduate Studies in Ethnic and African Studies at UFBA, the Anthropology Graduate Training at UFBA, the Graduate Training in Public Policies at Federal University of Maranhão, and it also counts on the Africa Multiple Cluster of Excellence in BIRAF, as much as all the team or support team for the factory. We count on the support of the Cape Verde University, Brazilian Association of Anthropology, Brazilian Association for Graduate Research in Social Sciences, and POCS, ABPC, and CBS. This event is supported by and organized by AGS9 and supported by Professor Raquel de Souza. To all involved, thank you for sharing actively your time with us. I informed that it's necessary to have 75% attendance rates in order to receive your certificates, and we are going to be paying attention to the chat box. Remember, let me remind you that you should focus on asking questions that are directly related to the topics debated at this table, in order to allow us to think about such complex themes. Today, the theme is gender approaches, pandemics in transnational contexts, that is going to be lectured by Professor AwinoOkech and Miriam Pilar Grossi, debated by Professor Felipe Fernandes. Thank you for your presence. Thank you for being here and sharing so generously your knowledge and your time in order for us to think about such drastic moments of the history of this planet. Professor Okech is the bachelor from Nairobi University, PhD from Cape Town University. Her research interests are in the nexus between sexuality, security, gender, and processes of creation, of nation-state creation in societies in conflict and post-conflict. She ponders on issues of production and transfer of knowledge, exploring the dynamics through choice, methodological and pedagogical choices in her research and in her classes. Before being chosen at the SOAS, she has worked in development sectors in several sub-regions in Africa for over a decade, supporting organizations and for the rights of women and supporting other organizations in promoting peace. Her work remains central for the Association of Studies and Teaching, illustrating continuous movement for social justice and feminist movements. In the CGSC, contributes to several graduate training courses: gender theory, queer politics in Asia, Africa, and Middle East, dissertation methods for gender studies and feminism, security in Africa, politics action, and gender. Thank you so much, Professor Okech.
Thank you very much for the invitation to come and speak with you this afternoon in my part of the world. So as I understood it, the intention is for us to think collectively together around some of the gendered impacts of responding to a global pandemic such as COVID-19. Now, I know that for many of us, we have been reflecting on this from the places in which we are positioned as individuals and recognizing the multiple ways in which our both reproductive and social reproductive roles are being called upon in our sort of intimate environments, but also how those therefore affect the professional environments and public environments within which we are interfacing with. But for the purposes of this presentation, I wanted to really draw on the work of an organization that I happen to be affiliated with, which is known as Just Associates, which works across sections of Southern Africa, Mesoamerica, and parts of Southeast Asia. And in thinking with Just Associates, which is a feminist movement support organization that builds collective power with community-based groups, networks, and movements, what I hope to do in responding to the questions around the gender dynamics of pandemics is to focus on what is called the Just Mobilization Fund, which is an initiative, a solidarity mechanism, if you will, that was established by Just in 2019, with the express intention of providing small, rapid resources to allies and partners to strengthen their organizing, particularly during moments of crisis. So JAS is not a funding organization, but this modality of providing solidarity, of working alongside communities and movements working towards social transformation is part of the tools, if you will, that the organization uses in its range of approaches towards providing support to movements in different parts of the world, but much more specifically within the regions that I've talked about. The reason why the Just Mobilization Fund is an interesting one to look at as part of sort of illustrating or looking at what are the gendered impacts of pandemics is one, because of the fact that it puts resources in the hands of feminist movements. It's not a fund per se, so the organizations and the allies that were benefiting from the resources that Just put in their hands.
Recording in progress.
That Just put in its hands, so to speak, were organizations that were looking to use these resources as part of their long-term strategy building work. So this was not an intervention that was generated or designed to be part of a new set of work, but that was recognizing that COVID-19, like many other health pandemics or like many other social problems, is really part of a constellation of factors that impacts and sort of exposes the deep cleavages and structural inequalities in our societies. But also it offered an opportunity to think about what happens in societies during crisis. How do societies mobilize, strategize, and engage to work against crisis situations, particularly communities on the margins of our societies? How do race, class, and gender play out in responses to crisis? And what can we learn when we pay attention to how feminist movements respond to crisis situations? What is interesting or what is useful about an intersectional analysis of crisis situations by paying attention to the responses of feminist movements? And this really is what I would like to focus our attention on, rather than an expose of sort of the structural factors that play into our understanding of COVID-19 and its impact. I'm much more interested in focusing our attention on what feminist movements did to respond to COVID-19 in this particular context, and what it tells us about the power of feminist movements and the importance of putting resources in the hands of feminist movements. Now, the reason why this is an interesting area of analysis is because there's a broad range of literature that sits in two areas. The first is the literature around humanitarian responses. And a lot of that literature that focuses on humanitarian responses you will find that there's been a lot of critique around approaches to humanitarian responses. So you can think about the work of Naomi Klein, who talks about disaster capitalism, for instance. But in the mainstream humanitarian literature, you're also thinking about broad debates that have been had around localization. And localization here simply means that when there's a crisis, and international organizations, whether those are INGOs or the UN, go into a situation, whether it's a hurricane, whether it's floods, or whether it's a health crisis, you are responding to a local situation. You're arriving into a context where there are a range of local actors who understand that context. They understand the networks, they understand the power dynamics, they understand how people are positioned in the society. And that if your humanitarian response is to be successful, then you must pay attention to the local actors, particularly because in most instances, they are the first responders, because they are the people who were there in the situation of crisis. But this critique arises, the critique of localization approaches in humanitarian responses arises from the fact that more often than not, humanitarian responses place greater power in the hands of externals, because of course of the resources that are coming in with externals, rather than placing power in the hands of the locals. This leads to a situation where you have fast responders, international responders, or regional responses that are not really, that do not really have an in-depth understanding of the context. And therefore those responses end up being surface and not necessarily useful to shifting the sort of inequalities that are magnified much more by humanitarian crisis where they unfold. The second layer to the question of localization is a gendered one, which is that in a lot of our societies, you will find that the inattentiveness to how gender as an analytical category, so the power inequalities that are generated by how our societies understand gender relations are magnified during humanitarian crisis. And that the reality is that when people are responding to humanitarian crisis, their responses mirror those gender neutral responses. So very little attention is paid to understanding how the power relations that are mapped onto gender relations in society are magnifying the exclusion, marginalization of men, women, gender non-conforming, and queer people in those societies. And so the responses end up heightening these inequalities rather than contributing to shifting them and redistributing the power inequalities or redistributing power in the society. So that's the first set of literature that we're interested in contributing to on the one hand, but also through an analysis of the Jazz Mobilization Fund and its work with feminist movements, we are arguing that localization approaches that put money in the hands of feminist movements are bound to benefit from an in-depth knowledge, deep contextual understanding of those societies, of those communities, and much more importantly, of the needs of those communities. So rather than a textbook response to this is a crisis, these are the series of things that we do in all crises, when you put money in the hands of feminist movements who are interrogating power, who are thinking about redistribution of power, who are thinking about destabilizing unequal power relations, you are bound to have a humanitarian response that does something much more robust than the responses that are inattentive to these power dynamics and the power inequalities and hierarchies that exist in those societies, which outsiders, on the one hand, but also insiders who are inattentive or disinterested in a power analysis are likely to reproduce. The second cluster of sort of literature or interventions that we are also seeking to engage with is the material around disaster capitalism, but much more critically, a framework called racialized disaster patriarchy that is an expansion of Naomi Klein's work on disaster capitalism. And so a scholar named Luft writes about racialized disaster patriarchy and is thinking about racialized disaster patriarchy from the vantage point of examining New Orleans post-Hurricane Katrina. And what they find in that context is, of course, an attentiveness to race and class by all means, a recognition of the marginalization of Black communities, the class dynamics that shape that racialized dispossession of communities. But what is evident in those responses post-Katrina is a reproduction of a gender-neutral response that continues to dispossess Black women. So even though there's an attentiveness to race and class in a post-Katrina environment in New Orleans, the dispossession of Black women continues because of a humanitarian response that is inattentive to the intersection of gender, race, and class. And so in the examination of the Just Mobilization Fund, as a sort of case study, if you will, of what it means to be attentive to feminist movements, we are also illustrating how feminist movements provide leadership through their responses that challenge a racialized disaster patriarchy approach that we see as evident when you think about or examine COVID-19 responses across different parts of the world. So that is sort of the overall framing that is useful to understanding the examples that I'm about to follow up on in a short while. Now, one of the things that all of us will sort of share an understanding on, because a lot has been written since COVID-19 sort of escalated in March 2020, is the sort of catalog of responses that different governments used in dealing with COVID-19. And so there are sort of three main approaches that can sort of be mapped as shared across the globe. One is, of course, a sort of militarized response. So the use of, or if you, let me rephrase that. So a militarized response in terms of getting police and boots on the ground to sort of manage people in certain parts of the world. And we see that in contexts such as Honduras, which is one of the countries that we talk about in this article. But we also see that across sections of Africa, where you find the military forces being called in to deal with curfews, the police, specialized police being called in to enforce curfews in different parts of our societies. But alongside that militarized response, we also see what is called a securitizing move. And this happens across the globe without exception. And the securitizing move here is the fact that governments sort of lift up COVID-19 as a national crisis that requires extraordinary mechanisms, which means that all of the rules and regulations that a government would ordinarily be required to follow, whether that is through parliamentary approvals or different kinds of engagements with society before certain laws and regulations are put into place, are cut. So the government is given extraordinary power to act because of the nature of the health crisis. And so the argument, therefore, is that the government can move quicker and with speed to deal with this crisis. And so you saw that across different parts of the world. The fact that governments were able to push regulations through parliament very quickly, through shorter periods of time because of the securitization of COVID-19. You saw that through the kinds of elasticity that was given to governments to collect data of citizens and to use that data for sort of health and tracking purposes. So the surveillance of citizens became something that was common and accepted because of the securitization of COVID-19 and the securitizing move that happened because of the sort of crisis created by COVID-19. Again, this is a shared dynamic. But another shared dynamic was the gendered repercussions of COVID-19 and across different parts of the world, in the UK where I currently live, but also in different parts of the world, which we look at in this paper, you begin to see a very close attention by feminist movements and different critical actors in saying that the experiences or the impact of COVID-19 is both racialized, it is class, but it is also gendered. And one of the main ways in which the sort of two main ways in which the gendered implications of the COVID-19 was sort of magnified was one, through the questions of violence. So the realization that a lot of people who, as a result of the regulations of stay at home, stay in place, shut the lockdowns and curfews and all of these mechanisms that were containing people within environments meant the rise of violence in domestic spaces, a rise in domestic violence, which was accompanied by the closure of safety nets that have been put in place by some governments or by civil society organizations to deal with the impact of domestic violence. And because shelters were closed, because you could not guarantee health security in those dynamics, you see an increase in domestic violence and other kinds of gendered violence within the society as a result of the COVID-19 measures put in place. So that became very obvious. Now, for many of us, of course, we have always known that domestic violence and gender-based violence is a crisis in our societies, but this suddenly became something that everyone became much more attuned to because it was in your face in ways that perhaps for them had never been in their faces before. But the second layer to the gendered implications of COVID-19 was around the nexus between the social reproduction and reproduction responsibilities. So here, the assumptions that the care work, the unpaid care work, would be predominantly held by people who are gendered as women in their household, would be predominantly held by people who are gendered as women within their communities. So the care-related work in the household, but also the broader care work that is associated with managing health crisis, sanitization, provision of water, cleanliness, that was absolutely essential that has been absolutely essential to COVID-19. And this reproductive care roles are therefore, you see them therefore map much more extensively from the internal environment in terms of the domestic space to also how the state and governments who are unable for a range of reasons, dereliction of duty, but also the sort of broader geopolitical global economic dynamics that has placed different kinds of inequalities in terms of governments' abilities to respond at pace to the escalation of COVID-19, meant the greater burden of responsibility on people gendered as women to take on these care responsibilities, unpaid care responsibilities within, as part of the responses, package of responsibilities that come with addressing COVID-19. So what therefore, if we recognize that these are the broad set of responses, that marginalization is sort of escalated, magnified during moments of crisis, and that communities on the margin are much more likely than most to not benefit from government responses to crises of this nature. What do we uncover when we pay attention to feminist movement responses, particularly those who are supported by the Just Mobilization Fund? And the first is that I think there is often a tendency when we think about humanitarian crisis responses or responses of any kind by civil society organizations to try and want to pay attention to the big things, right? We want to see how this intervention magnified, or we want to see statistics of how X intervention reduced the spread of COVID-19 by 50%. Now, this is not that story. That's not the story I'm aiming to tell here. The story I'm aiming to tell here is one that illustrates how small amounts of resources to communities on the margin prevent a situation from escalating when a government would not have been there, is not there to respond to the situation in which communities find themselves in as a result of their marginalization by that very government. So if you want an understanding of the impact of the work or the impact of the resources put in the hands of feminist movements, that impact is evident in the fact that there was a stopgap measure put in place when governments were absent. And that if no stopgap measure was put in place, we would actually not be having this conversation, given the virulent nature of COVID-19. So for example, in both Honduras, Indonesia, and Zimbabwe, which are some of the three countries where partners of JAS received small amounts of money as part of a crisis response mechanism, you saw three kinds of interventions. The first kind of intervention was a response to the very basic needs around health security. And here you're talking about the 3 Ps, you know, the 3 sort of main responses, which are around social distancing, wearing masks, and sanitization. Requirements, 3 requirements that are essential to spreading the curve of COVID-19, but which are very difficult to implement if you're living in socioeconomic conditions that do not allow you to social distance, that do not allow you to work from home, that do not make water and soap easily available to you all of the time, and that do not provide situations where you have masks to wear with regularity and keep them clean as part of the process of preventing the spread of COVID-19. So we are stuck with a sort of wicked problem in relation to COVID-19. And what happened with the feminist movements that were supported in Indonesia, in Honduras, and in Zimbabwe was an innovative response to dealing with questions of social distancing and sanitization through a retreat to indigenous modes of both health security, but indigenous modes of sanitization and cleanliness that were not reliant on a sort of capitalist mode of engagement where you required soap, where you required sanitization kits that you have to buy from the shop, which means that if you buy them today for 1 week, next week they're no longer there, and the problem that you have that you had before still maintains. So there's a response here that both draws on indigenous modes of knowledge, of health knowledge, of wellness knowledge that feminist movements are responding to, but they're also deriving a response to providing community safety, collective protection from their communities that is simply not based on responding to women's needs primarily. In essence, the argument that I'm making here is that feminist movements in this context were creating responses that would respond, that would manage the spread of the COVID-19 for the whole community, and not necessarily responses that only dealt with women's and girls' needs as a constituency, which has been the critique of localization approaches and humanitarian responses that tend to respond in a gender-neutral way, thereby sidelining the gendered needs and impact that humanitarian crises have on women and girls. So there's a point here about indigenous knowledge systems that are drawn on by feminist movements, but there's an accompanying point here around a holistic collective protection approach that is adopted by these feminist movements as part of their responses. And underlying both of these responses is sustainability, that these are modes of engagement that are sustainable beyond the small amount of money that was offered to them as part of a solidarity mechanism by Just Associates, but also goes beyond any other sort of responses by other actors should they come in if resources sort of wane away after the immediate crisis. Now, I want to give an example that I found very, very innovative, fascinating, and quite interesting, which comes from a community in Cape Town, the Ocean View settlement. And let's also remember that a lot of the communities and responses that were targeted through the Just Mobilization Fund were in informal settlements in many of these countries. So in Ocean View settlement in Cape Town, where resources were given to a local feminist movement collective that Just has been working with, what you saw these women do in that community was to immediately zone the community. To zone the community both in terms of those who are considered vulnerable and vulnerability across age, vulnerability across pre-existing health conditions. So there was a red zone, a green zone, and an amber zone to help deal with the questions of congestion and concomitantly address the vulnerability of members of the community and contain the spread of COVID-19. So rather than suggest that social distancing as a modality was going to work effectively in that context, given the realities of how the community is structured, they opted for a zoning mechanism as a mechanism to reduce the spread of COVID-19 and manage the vulnerabilities of members of the community based on the factors that I've described. The second thing that you saw happening in the community, and this we saw in Zimbabwe, where, again, working with in an informal settlement with sex workers in an informal settlement called Hopley in Zimbabwe, which again is an informal settlement that arose as a result of government policies, in the early 2000s that led to the dispossession of many communities that have not yet been rehomed. So there's a legacy as an economic legacy that shapes why this settlement exists. So working with sex workers who JAS has supported over a long period of time within the Hopley settlement, what the sex workers did, again, as part of these innovative responses to dealing with questions of vulnerability, is that you found that in a number of African countries, people were required to get special passes that allowed them to access particular spaces, particularly where lockdowns were in place, which therefore required that those limited movement of people, and also to ensure that they could access food materials, but also medical care materials. And so what these sex workers within the Hopley settlement did was to organize themselves and define themselves as essential workers, right? So deploying the very language of the state, which is around essential workers as categorized in very specific ways, deployed that language as a route to ensuring that they could, one, get access to the health centers in order to get the medication for individuals within the settlement who have been dealing with a range of pre-existing conditions, whether that's hypertension, high blood pressure, HIV/AIDS, diabetes, and a whole range of pre-existing conditions that would be magnified if anyone contracted COVID-19 in addition to those. But in addition to that, they also set up a system for reporting violence, particularly because sex workers in many parts of the world, and in Zimbabwe and in Hopley in particular, were not going to stop working as a result of COVID-19. So in both dealing with questions of labor and income that was going to be affected by lockdown measures put in place by the government, they were also concomitantly seeking to address the questions of violence that comes with the employment conditions that they find that they're in addition to the generalized violence that women face, whether they're sex workers or not, in many parts of our societies. And through the use of registered numbers for reporting violence where sex workers or members of their community faced specific forms of violence in the course of their work, they then developed a network of reporting and response. Now it's interesting, and it's an additional point around some of the strategies and tactics that JAS has sort of enabled as part of his long-term movement building work with different communities, is that part of the engagement with a lot of these movements has also been around what does security mean in this context. And so putting in place a security infrastructure that was about providing safety for sex workers as part of their employment conditions, but also part of their living conditions, became an important way of responding to the very specific gendered and classed impact of COVID-19 for the women in Hopley community. A third and final example, because I did not put on my timer, so I'm not very clear about time, of 5 more minutes, okay, is an example from Honduras. And this, again, really lifts up the questions of class and the impact of COVID-19 measures when taken by governments. And this is around the provision of medical supplies and food kitchens to vulnerable members of the community, the elderly, and those who are not going to continue to have access to food supplies as part of their response. So the resources that were provided by the Just Mobilization Fund went directly to setting up food kitchens to ensure the sustainability of the most vulnerable in the community. Because what we know in many parts of the world, that the number of people who are dying as a result of violence, state violence, people who are dying as a result of hunger, lack of food, was comparable, if you will, with the people who are dying directly from contracting COVID-19. In effect, many people weighed the sort of risks of getting COVID-19. Should I get COVID-19 by continuing to go to work, or should I stay at home, not get COVID-19 and starve to death? These are the kinds of calculations that many people make because of the class, the socioeconomic conditions engendered by how our societies are structured along gender, race, and class strata. I will stop there because my time is up and pick up more of the discussion during the Q&A. Thank you very much.
Thank you, Professor, for your brilliant explanation.
Agradeço por essa. I will thank you for this brilliant explanation. The Q&A box is already opened, and I would like to remind you all that the course that is going to be taught by Fábio Baqueiro and Professor Zamparoni will have their beginning postponed to Thursday, because Thursday 3rd is a holiday. So we are going to then postpone it to the 8th of June. We would like to thank you for your brilliant explanation on your research, Professor Okech. And now I would like to invite Professor Grossi, who is a professor teaching at the Anthropology Department at Santa Catarina University, the member of the CNPq research group. She is a doctor in social anthropology by Paris 5 University at the postdoctoral levels in the lab of social anthropology at the University of Berkeley, California. She's been teaching at the Ruth Cardoso Chair at Columbia University. She's been a visiting professor at Chile, Portugal, and France, and she's currently teaching at the interdisciplinary human sciences and courses in social anthropology at UFCS. She's been the president of UNPOX, president of ABA. She was the coordinator of the Gender Studies Institute at UFCS, and she's a member of councils and magazines and journals in gender studies and anthropology. She coordinates the Center for Gender and Subjectivities Identities. In its 30 years in researching national and international networks in the fields of gender, sexuality, public policy, education, diversities, history of anthropology, and qualitative research methodologies. Thank you, Professor Miriam. Grossi. Good morning. I'm very thankful for the invitation for being here and for the honor of establishing a dialogue with Professor Okech and Professor Fernandes and all of you who are here with us this morning, who are also going to establish a dialogue in the end. I would like to approach this theme that's been introduced here in terms of gender issues in transnational contexts, thinking more specifically about the situation in Brazil, particularly thinking about 4 issues, but perhaps I could focus on the 3 first, which is labor, health, violences, and then about the impact of social scientists and women in terms of these issues. I think that many of the issues I'm going to relate here have already been introduced by Professor Awino from a global standpoint, and I would like to think about the local issues in terms of the impacts in Brazil. In general terms, COVID-19 is going to have a strong impact in the labor force. I'm talking about academic work, maternity. I heard what Professor Awino talked in terms of sex workers. Unfortunately, we don't have a lot of data about that in Brazil, but I think that several of these boxes here just for us to think about them. First, several Brazilian researchers demonstrating that women in domestic work has increased exponentially in this last year. Women have accumulated over 30 weeks of workload, according to the Getúlio Vargas Institute. In terms of teaching, what we do, all the problems involving the issue of remote teaching, remote learning, all of that has been has been very present. It's present since the beginning of the pandemic. That is going to involve a number of dimensions. As you know, in Brazil, last year we had practically the whole year with people outside of our schools, and this year we've had the cleavage between public schools and private institutions, where public schools in their majority continue to be in remote learning. Others are striking, as is the case here, and private schools with management of teaching for those who have the different types of publics and of parents. But we see here, what we see is that we have professors that consider to be in several of these networks as priority groups for vaccination once that people over 60 years old have been vaccinated. But that's not yet a global issue. It's residual in terms of the number of people who have been vaccinated. So when we think about teaching, we see in these first 14 months, 15 months of the pandemic, that it's had an impact in terms of professors, particularly those who don't have formal network, formal ties with institutions, which it has then become a problem for those who are working. We have also seen that there has been, in terms of academic work, there's been a diminishing of productivity for women and researchers and mothers during the pandemics. The data here shows that the tasks and roles played by women in maternity have increased exponentially, particularly because mothers have to stay home and look after children and everything in between. And these are one of the current movements in private schools of answering to this public of mothers who don't have any a place to leave their children with. And then there's women and scientists. In this discussion, we are also going to see that many of the mothers who have this type of work, who didn't have a space for their children to stay. So these are mothers in the families then that take care of these children, grandmothers, aunts, who are raising these children, and there's an increase of mental health issues. Here in the slide, I'm playing some of this network in terms of women scientists that have been pointing out in terms of one of its first technical notes about the impact in education. Here is some data that demonstrate that 80% of professors are women in basic education. According to UNESCO, 44 million of Brazilian children have been directly affected and have been left outside of school in this last year in Brazil, remembering also that the legislation that provided resources for providing technical support was rejected by Bolsonaro, and there's also an increase of violence and abuse, sexual abuse in domestic realm, remembering that in school, this also the school has an important role in preventing and helping with issues of domestic violence. That's been also an in food unsafety, because many of these children ate at school. Financial instability for women who don't have where to leave their children, and it's been observed through IBGE that there's been a diminishing of work availability before women, and there's been a setback of 30 years in terms of inserting women in the labor force, both informal and formal markets in Brazil. Also, in terms of the field of work, we are thinking about where these women have been placed, particularly where they are located in terms of the struggles. These are activities give said as essential, explaining how sex workers then have placed in Zimbabwe their work as essential work. We know that these are the works that have the most impact in this field, in this particular aspect. First, nurses, women who are at the front of combating COVID-19, and we know that they have lowest paying positions vis-a-vis male nurses. Then for nurses, there are violences in terms of not having the opportunity of even drinking water or removing the protection equipment and several layers of clothing, the heat, particularly in spaces such as Manaus. This is a group of people who are at the battlefronts and having the direct impact of this type of work without any type of thinking of ways of relieving this type of discomfort in their workforce. Brazil is a country that has the largest number of, or the largest rates of death for nurses in the world. There's been 564 nurses and physicians that have died, who have died for COVID. We know that there's 50,000 nurses who are contaminated at the moment by the virus. We also, these are women or caregivers who are going to be part of, these are the caregivers for the sick, for the ill, for people with disabilities and the elderly. So these are the people who have the possibility of being infected by COVID. And another field that's been studied in other countries, north and in France, this is the place in which these women have been working as supermarket cashiers. So what is considered essential during COVID, these women haven't stopped working as cashiers. These women, essential workers for cleaning in all places, and particularly in services for cleaning in hospitals. And all of that has been leading to debates on global levels about this type of work of caregiving that has been approached by Professor Keshi. I'm going to move forward with my reflection. Some data, Brazilian data about the labor market. 7 million women have abandoned their markets when the quarantine started last March 2020. Now we have doubled that number of women who have lost their jobs. IPEA, the main research center for quantitative data in Brazil, it states that it's the first time that the majority of women are outside of the labor market in light of COVID-19. And in that sense, these are domestic workers, those who have been affected the most by this moment of the pandemic. 7 million domestic workers, knowing that over 70% of them did not have any labor rights, and for those, over 40% of them have lost their jobs. In terms of domestic work, we are also going to see that in Brazil, in light of the way of sexual labor is, particularly amongst heterosexual couples, is based on the support of domestic workers. It means that there's been an increase in terms of the work that is developed by women that counted on the support of for their roles, and they has been an increase in the work for women during this period of pandemics. Also, in terms of these are going to be the women who are going to have their workload increased, looking after the children and their relatives. And then there's been a massive abandonment of women and young people abandoning school during this time period of the pandemics. We don't have data yet because the census itself has not been carried on last year. This data is still partial, but we know that it's going to have a particularly in terms of education, which in the present, young women were the ones who spent the most time in schools in Brazil. And this is going to have a big impact in schooling for young women in Brazil. Also, it is important to state that these women, middle-aged women, and older women are the ones who look at
cuidam dos seus pais mais idosos e cuidam dos seus filhos, né, filhos
who look after their children and also grandsons and children at the moment, aside of looking after their husbands and relatives, and several million people who have been infected, and all of them have been looked after by women. The impact in terms of health, the women who have already been impacted by this work, the network again of women against COVID have announced in their second note what is the impact in terms of work in the field of health. This data, I'm not going to read it all, so to save time, women are in its majority of work. In nurses, these are only 36% in the case of physicians, and we've had amongst healthcare professionals 60%, over 60% were the ones affected. There's been 50% of deaths of all nurses in the world. As you know, what then increases this issue of contamination has to do also to this lack of vaccination, of testing, and particularly in terms of guidelines and management of the pandemics in Brazil. The feeling of people who work in this field of health and the lack of problems of mental health is very significant. And there's been also an increase in terms of sexual and moral harassment, particularly in terms of issues of gender in the spaces of hospitals. But an issue that is also very specific to Brazil and that's been pointed out since, but it's been visible for now, is that Brazil has 8 to each maternal deaths by COVID in the world is in Brazil. This is a very striking data, and we know that we could have already, in this year, if by January and April, we've had 526 maternal deaths by COVID in Brazil. So that demonstrates that these women who have died, pregnant women who have died from COVID, these were Black women who lived outside of these urban regions. Women have access to programs for the health of the family and who live over 100 kilometers away from major reference hospitals. There's also been an increase in terms of their occupation for women who have lost their children in hospital care. This has been leading to another very serious issue, which is the fact that women.
Como vai ser o cuidado dessas crianças órfãs de mães pela Covid, né? A gente, aqui são dados que eu também não vou ler, mas que são mais ou menos nesse sentido. Um dado que está ligado a essa questão do aumento de mortes maternas é que nós tivemos, a partir de março, pela primeira vez na história do Brasil, uma queda demográfica forte, dada ao fato de que tivemos mais mortes than
births, and that has never happened in the demographic history of Brazil. Moving forward, that has been really growing, we've been drawn to this particular topic, particularly in terms of the research by the Federal University of Sergipe. We have here my first slide, something data from the Forum of Public Safety demonstrating that there's been a big increase of women who had never denounced their partners, who are now denouncing gender violence more consistently since the beginning of the pandemics. And I have here the several types of violences that are linked in terms of Lei Maria da Penha. And the majority of these women argue that they endured psychological violence, which is an increase in terms of the traditional types of violences, physical violences, and an increase of threats in terms of threats. These data also evince that the majority of the women who are enduring violence are in the age range of between 30 and 40 years old, and this increase on a global scale of violence. These NGOs in China, where there was the first space where COVID was detected, these were the first to denounce the increase of domestic violence, and these denunciations, then we've seen NGOs and governments showing that this increase in light of lockdown and isolation in the domestic realms. There's been an increase also in Brazil in exponential ways, as I have demonstrated. But something I'm going to show now is that thanks to these denunciations, there's been a number of new initiatives in Brazil of in denouncing. Very quickly talking about this case on a local level in Santa Catarina, showing how there's been an increase in violence. I'm going to move forward, stating that there's been a concern in an increase of denunciation of violence against trans and lesbian women. In Paulo, Erica Malunguia has created a project for emergency support for trans and transvestite women, and this emergency support. There's also an increase of violence against LGBTQI plus people in domestic realms, also during the pandemic, situations in which people had to come out to their families, and there's been a violence increase against them as well. And then talking about the global aspect in Panama, lockdown was then women and men. Now there's been a discrimination against the trans population. In the work of Professor Patricia, through the media, she has observed the double movement of media analysis and social media in Brazil, a sexist reproduction of this violence by mainstream media and new communication strategies defending women. I'm going to show you some of the memes that Patricia and her team have organized, which were memes demonstrating how men felt unsafe vis-a-vis the pandemics. The first one here that I find interesting, an engineering talking to my friend, talking about how to deal with environmental tensions. And he said, let me wash my dishes with hot water under the surveillance of my wife. This is the first man who dies of coronavirus. The risk for women or men being poisoned by their wives. So how these memes then reflects these fantasies and these tensions that have been increased during the pandemics. Here we have a list of several initiatives that have been developed in Brazil. I'm going to move forward to the next slide, showing several of these campaigns, actually campaigns where you could go to drugstores and Magazine Luiza, and a number of companies that organize projects that were very efficient ways of combating the pandemics. In Minas Gerais, we've had some legislations in which these buildings or homes or conglomerates of homes then were forced or created mechanisms to denounce domestic violence. We had NGOs that in which justiceiras or justice makers, lawyers, psychologists, social assistants that have been providing support since the beginning of the pandemics. And very quickly, I want to talk about this articulation of scientists, of women scientists, and how these issues of gender have been debated in university settings and scientific fields. Remember that women have been protagonists in terms of being researchers, these being women who have been sequencing the genome of the virus in February last year, but very little is said about women scientists. And the same thing in terms of production of vaccines in Butantan and Fiocruz. When we talk about these vaccinations and those who are leading these projects, demonstrating that these are women, the moment in which there's been an exclusion of women in the COVID-19 hearing, Congress hearing, these women no women are a part of this committee, and every time they say anything or ask any questions, they are silenced, they are attacked. We have seen several sexist scenes since the beginning of these hearings, last 2 weeks ago. Social media has also been evincing this type of attacks, threats against the scientists, deputies, city hall members, and that have been denouncing these issues linked to politics and the management of the pandemics. So the first technical notes for this network of women scientists, and I think that one of the reactions in terms of academic social movement, remembering that in Brazil that these are the scientific associations in human sciences and social sciences that have had a predominant role in denouncing negationism and what's been happening in the mismanagement of COVID in Brazil. And this network has been created a month ago, and it has been launching 6 technical notes articulating women from different areas of expertise. And finally, we are also going to have in the social sciences in Brazil, and here I would like to compare some bulletins talk about similar issues in which French social scientists and Brazilian social scientists analyze the social impact of COVID. In the Brazilian case, we start with both. The 2 bulletins were released in March. Between the Brazilian and the French one, 3 days difference. We published here in Brazil 150 bulletins in French, one twice a week, publishing around 50 bulletins. But while in the Brazilian ones, we had many articles about genders of issues, the French, even talking about other circumstances in the world, talk about children and disabilities, but there's no bulletin about issues of gender. And that has to do with the different ways of engaging with social sciences in the planet vis-a-vis gender issues and these debates and the pandemics. And I think that it leads us to think about conclusions regarding the fact that in Brazil, one issue is that this management, this tragic management of the pandemics by the federal government has had a large impact, a dramatic impact in the population, but also over women, both for healthcare and work. The women in the management of people who are infected, but also a significant increase of the violence against women in Brazil. There's also been, as Professor AwinoOkech has presented, a strong articulation of social movements and companies and in local levels in the states in combating gender violences. In terms of the field, academic scientific field, we've seen that particularly in Brazil, the academic fields is a fundamental field in terms of combating and denouncing, public denunciation of this mismanagement and concrete proposals in terms of confronting COVID-19 in Brazil. Thank you so much. That's what I had to say.
Muito obrigado, professora Miriam. William.
Thank you, Professor Miriam Grossi. I think we are going to have a 5-minute break now. Thank you, Professor Miriam, Professor AwinoOkech. We are going to have a brief 5-minute break before we move into Fernandes' debate, and then we'll take back the Q&A as well. So then please share your questions.
Gente, o William acaba de me mandar uma mensagem dizendo que o Zoom dele travou, ele já retorna. Então, agora são 11h11, a gente retorna 11h16. Vamos fazer um pequeno intervalinho para ir ao banheiro, para a Raquel, nossa
5-minute break. He's reiterating again here.
descansar um pouquinho. Então, retornamos às 11h16. Então, gente, retomando a nossa atividade dessa manhã, infelizmente o nosso host, o William, ele teve um probleminha com o Zoom, mas em breve eu imagino que ele
So
retorne.
our host then has had a problem with his Zoom connection. So since I'm the debater, my name is Professor Felipe Fernandes. I am a professor at the Interdisciplinary Ethnic Studies and African Studies, along with this group of researchers. I am a doctor. I have a PhD in social sciences. I was able then to come back. William is able to come back. Zoom crashed here. Sorry about that. I would like to introduce Professor Fernandes, who is a professor at the Federal University of Bahia, who's got a bachelor's degree, and he's a coordinator of the GIRA, Feminist Politics of Education. He is a master's in Rio Grande. He's a doctor in social sciences in gender studies by the Federal University of Santa Catarina. And he's got a doctoral training from the City University of New York. And he works with subjectivities. And he has a postdoctoral degree in gender studies and social anthropology. And in 2018, he's been a visiting professor at the Quebec University in Montreal, and his research interests are public policies in gender and sexuality, as well as associative practices in LGBTQ feminist movements. And his main areas of expertise are gender, sexuality, and anthropology. Welcome, Professor Fernandes. Thank you, William, for this introduction. I would like to thank immensely Professor Livio Sansoni, Jamile Borges, Professor Fábio Baqueiro, Zamparoni, and several other people, AGS 9, who's been organizing this activity, Professor Raquel, for her interpretation, and to say it's a great honor to debate these two excellent professors, Professor Okech and Professor Grossi. Okech, I had the chance to listen to her in the Brazilian Association Congress that was organized in Fortaleza. We went to Fortaleza by bus. I don't know if any of you remember that. AwinoOkech was the keynote speaker in this event when the association was presided by Professor Luma Nogueira de Andrade, and it was one of the peak moments of that event. And Professor Miriam Grossi, that's been in the public scene, directing some social organizations, scientific organizations, particularly Brazilian Association of Anthropology and POX SBS, BCP, and also the Brazilian Association of Studies for the Mercosul. They've been a central role in disputing narratives about the pandemics and sharing reflections from the social sciences and the human sciences about the pandemic. Professor Miriam Grossi at the moment is the running for a position in her as a candidate, in which it talks about defending the space of human and social sciences in Brazilian society, and I think that's crucial. Professor AwinoOkech, in her lecture, she talks about her main axis of her reflection is the role of these organizations in funding local institutions that are in communities, as so to speak, at the foundation of developing this work as a grassroots movement, and how the circulation of these funds is important in the basis. I think, however, that the central point of her lecture is to how these feminist organizations and these networks reflecting, as AwinoOkech has stated, strategies, creative strategies for implementing preventive measures and systems of indigenous knowledge are fundamental so that we can confront particularly other strategies, biomedical, militarized, of strength over these prevention measures. And I remember that when I heard, I thought about a book that was published in the beginning of the pandemic, François Verger's, whose chapter is dedicated to care. François Verger is coming from a gender called La Réunion, but she lives in France, and she works in her book in decolonial feminism, this notion of caregiving that preceded the beginning of the pandemics and already placing the weight of caring and cleaning on the weight on the shoulders of Black women, Arab women, or non-white women rather. So that has reminded me in terms of the Françoise Verger reflections. And I also had the opportunity of participating in the Global Day for Combating LGBTQI phobia. And I was very surprised at the moment of that public hearing about a coalition of the LGBTQ movement and deputies treating the pandemics in ways in a perspective of an existentialist perspective. And very few narratives and propositions, concrete propositions in terms of more sustainable policies, such as ensuring emergency aid for the LGBTQ population. And these were the issues that came to mind during AwinoOkech's lecture, because since we circulate these financial resources amongst feminist movements that produce this knowledge focused on inequalities of power and positions in communities, how then can we have this knowledge that is produced circulating in such a way that other communities may benefit? I find myself isolated in a rural community. Miriam Grossi knows this location where I find myself. I'm isolated in, and I had the opportunity of tracing ethnography of the pandemics here, listening in particular to women, a majority Black community of low income and resources. And many of them had no formal jobs. And then after the pandemics, and they have lost any ways of gaining resources. So this emergency aid was the only resource available in these rural communities. It was really good to hear Professor Awino, and a lot of what's produced in feminist movements are different in terms of what I have been finding in narratives for women, but there are many coincidences in terms of narratives for these women in the village where I live in and where I find myself since March of last year, is the low circulation of resources and the food security as a human right is an issue. I wrote about that last year, and it has remained that way. So we are living a situation of hunger. I was invited for something, for a bean stew, but however, she warned me there's no meat in this bean stew. So I'm trying to bring some new elements for reflecting with you. Moreover, I also enjoy the fact that both Professor Miriam and Avino brought the issue of violence against sex workers in terms of the recent publication of the gay group of Bahia that demonstrate the 237 deaths and an increase of these death rates for transvestites and transsexuals as well. So while a majority of all population, particularly urban population, is in isolation, trans women and transvestites, particularly those who live in the streets, who are either sex workers, but the majority are sex workers, they've been then more effectively by hate crimes and violence. So I would like you to then comment a bit more about this space for the feminist movement, be in science or in ground movements and community movements, in producing not only strategies such as maintaining and creating strategies, community strategies for prevention to COVID-19, but also the challenge, which is circulating this community knowledge so that other communities in the global south in particular may benefit. I would like you to talk a bit more about that. How can we create networks so that these informations, particularly, I say, in communities for lower class of low income communities, for both Professor Okech and Grossi, where it's hardly possible to maintain social isolation standards, as particularly as it being defined by the media. It's hard to that these guidelines may hardly be followed by a majority of low-income Black communities in Brazil. The homes are very small. The street is an extension of the home. There is the culture of the free fairs, very similar to the context of African countries. People don't have enough wealth to buy rice for the whole week. They need to, then it has become here current the practice of running the numbers, if you will, in which people then have to fill up 500 numbers, and part of those resources then organizing these raffles have become a way of circulating resources. And since the beginning of the pandemic, we've had heard some narratives about the extra workload for women who are in isolation, the low productivity for women in sciences, the increase of domestic violence against women during the COVID-19 pandemics. However, we haven't heard enough about the impacts, and I know that since both of you, Avino and Miriam Grossi, are specialists in this field, and thinking about the impact of the COVID-19 pandemics and LGBTQ people you have mentioned, but I think that we could think about it in more specific terms. I've been reading some productions. Edward Gonzalez and myself are going to launch a text in the South magazine from our program about issues of gender and sexuality during the pandemics, but we don't have enough contributions in the social sciences in terms of LGBTQ populations. We have Marco José Duarte, necropolitics of dissident sexualities or non-conforming sexualities, Peros Navar, histories of queer antenna, which were organized at UFMG, talking about the experiences of LGBTQ people, both talking about Brazil and Latin America, but we also have the journal Disability in the Global South, talking about the mental health of LGBTQ people during the pandemics in India, where the major impact for this LGBTQ population is part of is an issue of mental health and loneliness and family exclusion. So then I would like to state that I really enjoyed both presentations, and I would like you to then comment on a little bit more on the impact of these pandemics for LGBTQ populations. Thank you.
Travou de novo. Destravou. Olá, pessoal. Muito obrigado, professor Felipe, pela explanação.
Thank you,
Obrigado,
Professor
pelas
Felipe, for your
considerações,
explanation.
observações.
Thank you for your
Vou pegar
explanations,
carona aqui na pergunta
for your
do professor
presentations,
Felipe,
Professor Grossi and
algumas
Okechi.
que chegaram.
And then I'm going to
Eu
bring
vou,
forth some questions
eu
that
vou
have been
fazer
offered
a
through
professora
my
Patrícia
chat.
Gomes pergunta
Professor
para
Patricia Gomes is
que
asking both
possibilidades
lecturers,
vocês
what
veem
are
a
the
partir das
possibilities
vossas
that you see
experiências de
in
pesquisa
your
na
experiences of
compreensão
research
dessas
experiences in
agendas
terms of
comuns de
thinking about these
mulheres a partir
common
das
agendas
pesquisas.
for women within academia?
E esse diálogo entre
In this
academia e
dialogue
movimentos
between
sociais,
academia
a
and
partir
social
da
movements
problemática,
from the
como
issues of the
essas
pandemics,
questões
how
emergiram no
these
processo de
issues
pesquisa das
emerged
professoras e professores.
in your research
E uma
process.
outra questão aqui
And there's also an issue here specific,
acessar
which
diretamente
is
a
directly
professora
to Professor Okechi.
Eu vou passar a palavra para
I
as
am
professoras
going to
agora,
have you
depois ela
address this
retorna,
first
tá?
set of
Começam
this
três
first
perguntas
question,
anteriores.
and then I'm going to bring forth new ones.
Quem pode começar?
Please, who would like to go first?
Miriam, do you want to go first?
You wish you can begin? Well, I can. Bom, são muitas perguntas do Felipe.
So these are many questions here. We could spend questions. Let's talk about Patricia's question, which is more direct. Two questions that you're asking here. One is about what possibilities of articulation for women in the current context, and it makes me think about the post-pandemics. What do you think of? What do we have in mind for the post-pandemic? How do we see this issue of the social movements during the pandemics? I think that there are several issues placed here. One, when we are thinking about this post-pandemics, there is an pessimist movement, thinking that several issues that we have accumulated in terms of positive results or outcomes, this is a positive movement, gathering people who are coming from all over the world, establishing dialogues through digital technology. And these are issues that we know that we wouldn't go back in terms of being incorporated forever. In terms of this digital technology and this training we've had in using it, Zoom, Google Meet, and so on and so forth, that has allowed us and it allowed all of us to establish a broader transnational global dialogue and also a dialogue amongst groups that traditionally wouldn't meet or speak. I've been invited to speak to groups, political groups, social movement groups, to read beyond the academic field in which I'm is usually in dialogue. So I think that this is something that has demonstrated to be efficient during the pandemics in political articulation for movements, and I think that there's something that may remain. And aside from that, today we have the wonderful Raquel interpreting, but we know this is not an easy thing, particularly for us Brazilians who don't speak other foreign languages. But I think this issue of interpretation, we have been able to find mechanisms for translating and through technologies and more solidary processes of translation through chat, We've had many experiences of this nature. We had a meeting where we translated their lectures through chat, so linguistic accessibility has been something that has allowed us to expand our dialogues. Then I'm going to address again, but first I would like to listen to Professor Okech.
Thank you. So I'm one of those people who feels that COVID-19 continues to rupture the way in which we think about our society and our world. And there's no likelihood that we are ever going to return to any kind of environment that looks remotely like what it was before. Just simply because of the nature of this illness. I remember in March, when we first went into lockdown in the UK, and then the lockdown continued for a long time. And I began to ask myself, what is it that we did to their ancestors that we need to apologize for? Because we have received the message. If there's a message that you wanted to send, we have received it. And here we are a year plus later, still dealing with a virus that is mutating in such difficult ways and is binding us together globally in such complex ways, in ways that not even the HIV/AIDS virus did, to be quite honest. And I think that for me, one of the biggest lessons that I've drawn from feminist movements that I continue to be in conversation with, because that is where I came from before I arrived in the academy, is what they have shown us about an ethics of care and what it means to center feminist care as part of how we think about rebuilding our societies. And this is from the very basic factors of organizations, feminist organizations that I know of, that in the immediate moment when many countries were going into lockdown, shut down. They said there's no need for us to continue to pretend that we have just simply moved into a different modality of working. No, the world things are not okay. And it's important for us to sit still and think about what that means for how to continue to work with each other. Now, of course, within the academic environment, we simply moved office, right? Carried our computers, sat in our cramped households, depending on where you were in the world, and operated as though the world still continued because of neoliberalism and the fact that you have a university, people have paid fees, there's exams, things have to continue, including recruiting new students in the new academic year, knowing that there was a global pandemic and the expectation that students had as well in this particular environment and are feeling hard done by because now they're sitting in a virtual environment, So this very complex global economic and political environment that we found ourselves in, which we were still trying to lie to ourselves that we can continue as normal. But on the other hand, feminist movements were telling us, no, there's nothing that is normal about this. And it requires us to change our modalities of engaging with each other. It requires us, feminist movements were among the first people who were talking about questions of mental health and care within our environments. So the big lesson for me, and this is a lesson I take as a feminist teacher, if I was ever a university administrator, I would take it into how I worked with colleagues, is how do we show up and build communities of care within our work environments, remembering that when we walk into any environment, we come with a whole lot of things. It's not just the teacher who is in front of you. It's not just the IT technician who is in front of you. There's an entire life that is behind them that impacts how they show up in the workplace. So care for me has been a big bridging thing that I think feminist scholars write about quite eloquently, but we don't quite know how to translate these wonderful things that we talk about into our daily praxis with each other. I remember laughing with some colleagues when the university, for instance, many universities said, if you're struggling, you can pop in for coffee and all of these things. Yet Often people don't understand that when you're struggling, you don't want to pop in for another coffee. So even the way in which we respond to creating communities of care is still placing an additional burden for those who are struggling to show up and be supported. So lots of lessons there for us, and there are examples from feminist movements on how to build communities of care in ways that do not reproduce the sort of racialized and classed burdens that come with holding people in a work environment. I think the second thing, and this is the point that Felipe, sort of lifts up in their response, is the question of mutual aid, right? One can think about what JAS was doing as a mutual aid mechanism. It's a mutual aid mechanism because you're finding these are resources that are about solidarity. This is not about funding. This is not about saying, I have given you $5,000. Now I need you to show me pictures of before and after. I need you to prove the impact of your work. This is about recognizing that that money is insignificant. Let's be clear about it. It's actually a tiny amount of money. That is not the money that's going to change the world. But because of the nature of inequalities in our society, it is so important in communities that are marginalized. But we are not going to create an additional burden for you by requiring you to report on it. See it as a mechanism of solidarity. Financial resources are political. Money is political. And so we're giving you that money as an act of solidarity. Let it do something. Let it plug a hole. Let it plug a gap in a moment in which your communities are so disconnected from governments that are required, because you vote for them, because they take over power violently, to care for you as members of that society. That even when donor funds are available, the hoops that you have to jump are so many that by the time the money comes, you don't even want it anymore. In fact, the crisis that it was designed to respond to has mutated so much that those resources no longer matter in the same way. So our second big lesson from this moment has been around how communities have rallied around each other through mutual aid mechanisms. And mutual aid mechanisms as solidarity, money as a political resource, and not as a resource for transacting power relations, but as a resource that allows us to do certain things within a capitalist framework that allows us to shift and move bodies, move food, move human beings across different spaces, get medicine into communities when it's most needed, get water into communities when it's most needed because our governments have failed us. And because mutual aid occurs within a framework of solidarity and a framework of structural analysis of the situations that we find ourselves in. One of the things that I also wanted to lift up is that in all of this work that JAS was doing with movements, the buying of food, the provision of water, the setting up of kitchens becomes a site of convening and a site of strategizing to begin to tactically organize around the inequalities that are producing these dynamics. Because let's be clear, when people are setting up soup kitchens to serve thousands of people in a community, those soup kitchens do not exist in the well-to-do parts of the city because no one needs those soup kitchens. So when people convene because they don't have the money to be able to feed themselves because the markets are closed, they cannot get their goods to the markets and get money, so it's this cyclical chain. That space allows feminists to convene and say, what is going on here? Let's build our power analysis. Let's understand that the reason why we are all together in this space is because of a structural system that puts a majority of us in this place while it benefits a few in the society. So the provision of basic needs as an entry point to a strategizing space. Because I think historically the arguments around providing basic needs as disconnected from the political analysis is one that these kinds of arrangements begins to challenge. People need food. Let's not lie that people don't need food, water, and housing. But in the process of getting that food, water, and housing, can we have a conversation about why Felipe has got running water and you don't? Why is it that Felipe can walk down the road, even though there's a lockdown, and buy food, but you don't? Because the local shop does not have that food. The local shop has been closed for many months. The road network is so poor, so that power analysis happens around these processes of building communities together. And maybe the translation that we can have within sort of the academic environment, if I link back, to Miriam's presentation, is that one of my biggest lessons as an academic working in the West, which might be very different if I was working on the African continent, is the limits to how we organize as academics to think about these structural questions and put our energy behind transforming the institutions that we work in. So I think we see the limits of our organizing as lying within the material that we produce, and not that our work conditions, our labor conditions, the institutions that we work in, actually mirror those very unjust worlds that we are analyzing. What are the forms of solidarity that we can bring into those workplaces? Because as Zoom has become the site of convening, we have all witnessed, the complexities of what it means to work via Zoom, whether you're in the so-called developed world or in the so-called non-developed world. That there are people who are juggling 3 or 4 children, and husbands are working in the background, and you can see the stress on people's faces. And people, this is our shared experience. What is it telling us about our life worlds, which we tend to hide when we come into the workplace? Because we can leave that life world for a minute and transition into a professional environment where that is apparently, we do not need to see it, because now you're in the workplace. I'll stop there.
Thank you so much, Professor, for this brilliant answer. Temos aqui uma pergunta que foi trazida por Sinomanira. E essa
We have a question here that was brought by Sino Maneiro. It was addressed in the chat, but perhaps not everybody has seen this question and its respective answer. So here is, I would like to invite you to address it. The question, since the activities of sex workers are not legally recognized in many countries in Africa, it is actually a witch hunt. How can we ensure that they are protected, that they will be protected and less exposed to the impacts of the virus?
I think that the most important thing, as I put in the chart, is to listen. Is to listen to sex worker movements, and they are the ones who have provided the analysis into what it means to protect sex workers from COVID-19. And for me, I would only offer one fundamental argument, which is that if sex work is work, in the same way that you're protecting all workers and providing loans and security mechanisms, that is the same thing that needs to be extended to sex workers. That is the protection they require, because all, people who are doing construction work, and all this kind of thing are being allowed to continue with work or are being followed, which is the language that is used here, in the UK, and the government is providing resources to ensure that you're taken care of. So why are we not able to provide these kinds of resources for sex workers as well? And the second point would really be a point around solidarity, right? So sex workers, like all other workers who exist on the margins of our society, are facing the same kinds of violence from governments and other non-state actors when they cannot conform to curfews and lockdowns, because they have no option but to get to work. And by the time they leave work, the public transport system is congested. They are always, that was happening in my country, Kenya. They're always going to be caught outside of the household before curfew is over, simply because of the conditions of their labor, the distances that they have to travel, the infrastructure and network possibilities. So it is in moments like this, when an issue binds all of us in such intricate ways, that solidarity needs to be built. That the issues of workers who are legitimately recognized as workers are as connected to those of sex workers as they are, to others who feel protected by state and labor unions in different parts of our countries. So solidarity and recognize sex workers' work, and therefore treat it in the same way as you would the protections offered to other workers during COVID-19.
Thank you, Professor. Então, vou retomar aquela parte da pergunta da professora Patrícia, né, para a professora Miriam Grossi e o professor Felipe retomar.
This question, then I would like to go back to the question in terms of this dialogue between academia and social movements, and then I'm going to then roll into the next question. Professor Miriam, I would like to know how the category of race emerges in the context of these bulletins about COVID-19 and gender.
Bom, sobre a questão raça, eu acho que uma questão, né, Amanda, muito bom tu teres perguntado.
About the issue of race, it's good that you have asked this question because we've had 150 actives in the production of this bulletin, which was social sciences and COVID-19, and what drew our attention is that in these articles that we have published, there were very few taking into consideration issues of race, and that has led us to observe how much, for example, in the POSAFRO, in this program, in Factory of Ideas, race is a central and fundamental issue. For the body of social scientists in Brazil, it remains something that deserves very little attention, that it doesn't seem to be a focus of analysis. So in order to address this gap that we find very serious in the issuing of the bulletin, the second edition of this bulletin was specifically about ethnic and racial issues. It was published, and she has published around 50 issues specifically dealing with ethnic and racial issues, but something that Paulo describes in the final analysis in terms of this bulletin cycle is that the specific theme of the impacts of the pandemics about issues of race was not so spontaneously. It was more demand, therefore. It's a gap that needs to be addressed, but for example, I suggest the students here who should be concerned with this issue, and it's a very serious gap in the social sciences in Brazil.
E aí eu acho que também quando a gente fala da questão étnico-racial, me parece que é fundamental pensar também nas questões indígenas, né? Lembrando, e aí já retomando um pouco, respondendo talvez uma das perguntas do Felipe, né, na intervenção dele, sobre essas redes de solidariedade que a pandemia vai trazer, eu acho que...
Solidarity networks brought up by the pandemics, indigenous movement have been teaching us very important lessons in that sense. All of us know that the project, the genocidal project of the current government has indigenous populations as one of this main target, and they have organized themselves in very concrete and practical ways, shutting down villages, shutting down entries in these villages, building small hospitals in spaces for healthcare in order to so that nobody would leave the village to be cared for elsewhere. And there's several statements, if you would like to follow the Unbox page. In the last meeting, we had a very interesting table, and all of these activities in terms of the reflections that we offer here about feminism in the space of women in this management, local management, and more group management for the pandemics. In the majority of these indigenous groups, the women were responsible for the management, economic management, as well as caring in these villages. So when we think about ethnic and racial issues, the Brazilian case in terms of thinking of indigenous issues is really relevant because we know that the models of community organization have been very important. And in talking about community models, São Felix, where he lives, he provides examples, and also seeing at this moment that Rina has stated first. Felipe has talked about small raffles that circulate. All of us have been going through this last year, immersed in these raffles and small cooperative fundraising efforts in several projects and in concrete interventions, particularly interventions for combating hunger in several communities. Have been participating regularly in many of these interventions. Hence, I believe there's undoubtedly something that's positive, there's more effective and real involvement in concrete interventions in communities where we know the people who are in leadership roles and whose interventions, whose objective concrete interventions, particularly in combating hunger in a country in which we, since January, have very little financial support. I think that's an issue that is marked by these paths. Next time, I'm going to talk about an experience of self-help that we've had here in my team. But I'll talk about that next round of questions. Then, if you would, Miriam, since March, I've been working directly with indigenous people in Bahia, and I think that's very relevant to bring to this debate. This was the prioritization of these communities in vaccination campaigns, and particularly how indigenous communities have been attacked because they've given priority. So in March of this year, all of my students, indigenous students, were already vaccinated. And the amount of attacks was such to these populations because they were prioritizing this vaccination campaigns that they have organized a number of podcasts, including the first episode is already available at Instagram. It's called at Pet Communities. And these are the majority women, indigenous people studying at the Federal University of Bahia. In order to provide counter arguments in terms of why indigenous people were given priority in vaccination campaigns. So it is important to debate that in terms of how these populations were attacked throughout the pandemics. Aside from just by looking at Spotify, we have a podcast called Copio Parente, a large campaign that was talked about vaccinating your relatives, demonstrating how these populations and communities have been made vulnerable during the pandemics. Though the SUS has guaranteed the vaccine, mass vaccination for indigenous and Maroon community members. I remember that in the disciplines where I worked in terms of social scientist bulletins, that always we heard about the forgettings. So that subject was not addressed as though it's been deprioritized. I work in a program in teaching gender, sex, and LGBTQs. So people then were pointing out, and as though we are the most homophobic people in the planet, who had forgotten, but listening AwinoOkech, it is important to remember that when at the heat of the moment, when Brazilian scientists were providing answers to what happened, many of my concerns, and I include that as a researcher, as a queer theory scholar, in living in, since we already live in an LGBTQ terminology, my focus is in texts by Professor Sérgio Carrera and other professors. In the heat of the moment of the first weeks, some subjects were not addressed because we were being confronted by a negationist, and that's the word that we use, but now we have, and we are no longer using, we are using the word genocide. And as I wrote my text, I explained, you are there debating remote learning, if there's computer, if there's no computer, and other issues. But here, what we are seeing here is the right to feel food security, as Awino has stated. And I enjoyed listening to her stating that food and water needs to be ensured, but what kinds of conversations may we have alongside? We didn't have conversations. We were just trying to overcome these issues in the heat of the debate. So this is a very interesting debate. I think that I read an article now about in terms of these topics.
Então, temos ainda aqui mais uma pergunta, e eu queria acrescentar uma questão a essa questão da timeline de desenvolvimento de combate às endemias e pandemias, porque a gente ainda vive a situação de combate às infecções por HIV, e foram 40 anos, né, de pesquisa para ter avanços mais satisfatórios, porque é uma doença que passa pelo lugar, não é uma doença, perdão, é um quadro viral que passa por um lugar muito da moralidade. E a questão do coronavírus, a gente teve um desenvolvimento em tempo recorde, né, de vacina de 9 meses. Isso também passa muito pelo lugar da leitura de onde estão localizadas essas pessoas que estão sendo vitimadas, que é uma coisa bem interessante para a gente se pensar. E aí eu queria trazer, e a partir dessas análises ainda apontam a fragilidade, né, da academia ao observar de forma interseccionada as diversas questões. Isso fala muito mais do lugar da academia e da instituição, das pessoas que ainda compõem essa instituição, do que das pessoas que precisam desse diálogo em si. Mas vamos lá, tenho ainda mais uma pergunta para a professora Okech. A professora Okech está aí? Professor Okech? Do you hear me? Hello, Professor Okech, do you hear me? I have one more question for you.
Can you hear me, Professor Okech? Amanda is asking, Professor Okech, and as you ask the question in terms of looking at the answers provided by the pandemic crisis, Amanda would like to know about initiatives and local strategies for the LGBTQ movement in the context of the African continent, in terms of welcoming other strategies, how this issue has emerged during your research. Could you understand the question? Just shake your head. Okay, thank you.
So part of the sort of body of work that we're looking at with Just Associates also involved support that they gave to trans movement organizing in Zimbabwe in particular, but also in sections of Kenya. And this was directly as a result of ongoing issues with refugee management in the northern part of the country and the closure of one of the largest refugee camps in Kenya. Again, I think that, and this is an argument that many people have made, so it's just worth restating it here, that any strategies that any movements were engaging in at this particular moment were shaped not by COVID-19, were not a response to COVID-19, but were a response to issues that were magnified by COVID-19. So they form part of the constellation of actions that these movements have already been making to address inequalities that are generated by gender, by race, by class, depending on the positioning of the groups in questions. So COVID-19 simply adds, to the pot of issues that they have to deal with, but their strategic organizing was always at play. And I think that, and this is a point that I often make in relation to queer organizing across the African continent, that we really must be attentive to class, and that the experiences of queer people in terms of space, activism, and engagement, including basic questions around survival, is at the heart of it is a class question. Because when you're located in a certain part of that society, as a queer person, your experiences of exclusion, marginalization, and attack and ostracization from this community is really based on your class positioning. The more marginalized you are, the more likely you are to experience the highest effects of not having a job, not having an income, being kicked out of your household by the landlord, than if you have a disposable income, you have a good job, you live on quote unquote the right side, the right part of the city. So a class analysis of queer organizing and queer experiences is absolutely essential when we're thinking about queer movements on the continent. And the reason why this class analysis becomes important is because if you think about the range of activism that has been happening in the last 3 or so years, particularly around the repeal of penal codes across sections of the African continent that criminalize same-sex activity. And I think it's always important to emphasize that what is being criminalized is activity. Now, of course, one can then translate that to say, well, if you criminalize activity, then you're criminalizing the people. But if we want to get lawyers at their game, then let's recognize that what they're criminalizing is the activity and not criminalizing the people. But you have also seen a lot of public organizing by queer organizations and networks to challenge the state, to challenge governments around continuing to have these laws that are colonial laws within the legal system of various countries. And we've seen some successes in places like, Namibia. Even in the Kenyan context, that can be viewed as a success, even though the penal code was not repealed. But the fact that you had very visible, active, and engaged organizing by queer movements is an important signal of how we read and understand what it means to live a queer life on the continent. I will end by saying 2 days ago, I saw somebody from the US tweeting about, oh my God, I can't, I want to go to the continent, the African continent, but they will kill me. And I thought to myself, in 2021, surely are we still having these kinds of conversations? Surely you know that even in the US, the likelihood of you being attacked because of your gender identity is as high as it is that if you travel to Mexico, Brazil, Nairobi, or Cape Town, or Bamako, and that it's not our geographical locations that determine how we experience insecurity and violence, but that it's the structural underpinnings of how our societies understand gender and the power disparities that are associated with that leads to experiences of exclusion irrespective of our location. So really, to summarize, strategies by queer movements and sex workers and feminist movements dealing with a whole range of issues were always linked to long-term organizing around these particular questions, modified, of course, by the realities of COVID-19, virtual engagements, broader transnational conversations, as Miriam argued, have opened up, innovation in relation to using social media, WhatsApp channels, radio, returning to some of these mechanisms of engagement that we had long since forgotten because we were able to travel and there was a lot of tech savviness, but also to always think about a class analysis as central to understanding queer organizing across the African continent, and to remember that it's not the geographical location that determines dispossession and determines inequalities, but rather the structural foundations of those inequalities, which are shared globally. Thanks.
Obrigada, professora. Chegaram aqui mais duas questões, a gente está quase atingindo o nosso teto, né, que é às 12h30.
Have a couple of questions more, and these are questions that I would like you both, when you then address these questions, then you elaborate your final remarks, and so that we can end this session on time. We have here a question by Catarina Silva. These politics of care and solidarity are articulated with others through social changes, or the sanitary crisis of COVID does not allow and will not allow us to think and struggle for changes in social in our societies. And a second question, how to think about strategies and interventions in order to address social inequalities that are affecting Black populations in a state that do not value plurality. And then Professor Felipe and Professor Okech, and then we wrap up this session. I just actually would like to thank you for organizing this debate, to have the opportunity of debating with these two professors so that we can establish a dialogue beyond what's being stated here, because these are very important professors, both in terms of their contexts, in terms of their schools of thought. Professor Awino, but also Professor Miriam, talking about the importance of the reflection about social class, particularly in countries as Brazil, in which the social pyramid is so unequal. Then oftentimes what is proposed as a politics for the pandemics, if we don't have a gender lens linked to all the social markers in terms of economic differences and sexuality, we won't be able to then address all the inequalities that are present in this crisis that we are living, particularly in a negationist country such as ours, where the president is constantly promoting agglomerations with maskless people at a moment in which we reach 500,000 deaths in a clear references as the scenes through the electoral campaign as a fascist scene by Mussolini. He's just a plagiarizer, an ignorant plagiarizer of Nazi, European Nazism, reproducing that proudly. So unfortunately, we are in a country in which negationism is a state governmental policies. It's shameful. And Miriam Grossi has actually been a part of the parliamentary research in terms of there was deliberate interventions from the federal government promoting contamination from people from low-income communities. In Bahia, we have 1.5 million adult people who are illiterate in Bahia. We have low schooling. We are talking about 1.5 million people, we are talking then about people who are vulnerable to fake news and other similar issues. And then it's important for us to listen to Professor Miriam Grossi and AwinoOkech and bringing lens that are often addressed in general in the social sciences and human sciences as specific issues, but not only is it specific, but it's also become central in understanding these differences in social inequalities during the pandemics. And the podcast for indigenous population in Bahia that unfortunately, in light of these vulnerabilities that they are facing, have to justify why they have been prioritized vis-a-vis so many attacks. Miriam Gross has showed some of the sexist, heterosexist memes that have been circulating and the attacks that indigenous and maroon communities have been suffering in Brazil in order to, since they have been prioritized, have been great in terms of solidarities because these populations, autochthonous population, have been dealing with extreme losses in this epidemic of also of mental health issues. So it's been a pleasure to learn from you today, and I hope we can continue this dialogue at some other occasion. So we should move on into our final remarks. Thank you for for this opportunity. I think this dialogue has been great, and I think in terms of what Felipe has been stating in terms of the indigenous populations, I think that vaccination for indigenous populations as priority groups have been a result of struggles in the judicial system, in the Supreme Court. And it was not something that it was given to us. It was a process of struggle. And we should also remember that in this process, indigenous people who are not located in villages at first, were excluded from priority groups because of this fantasy that there's a pure indigenous person isolated from society. These are the indigenous people who should then receive the care from the state, and this is a part of what we have in Brazil since the SPI, this notion of tutelage. So the indigenous groups, and their majority are women, indigenous women who were ahead of these movements and investing in this battle. And I think that the prioritizing of indigenous groups needs to be understood in that way. And also about vaccinations and priorities and groups, this issue makes me think about a number of issues that I've been thinking about in terms of inviting you students in this group. An issue that I've been wondering about is, why is it that in terms of rethinking together and critically also the priorities that have been built in terms of vaccination process in Brazil. And I've been thinking in these last days exactly about these disputes that have been taking place at the moment in terms of comorbidities. And I think that there are issues that makes us wonder. Professor Okech has talked about the HIV/AIDS as one of these global pandemics that our population, LGBTQI, have endured, and that has forced us as communities, local and global communities, to craft a number of procedures, ethical procedures in terms of those who should be cared for, what are the priorities vis-a-vis the pandemics. I think that the LGBTQ community has had also another research theme that I launched to you I think that very little work has been developed, and even though we think about, oh, let's think about the AIDS epidemics, but I think that very little studies have been developed in terms of the accumulation of these collective social answers to HIV/AIDS in the world, but in particular in Brazil, how these issues and this accumulation has had an impact in confronting the the COVID-19 pandemics in Brazil. I think this is an issue that still needs to be addressed. How these communities were, what kind of mobilizations did they organize? How did these communities, contemporary communities, these groups, active groups in young people, what is the memory that they have in terms of the struggles we had in the HIV/AIDS and in our achievements in terms of these rights in Brazil? Brazil is a country that's had universal access to the treatment of HIV/AIDS. That was also an outcome of struggles that we need to report back to, and what I have argued. And I think about the work that by Cristiana Bastos in terms of the social answers vis-a-vis AIDS in Brazil were articulated amongst LGBTQ movements, not only gays, but trans people, sex workers, prostitutes, lesbians, had a key role in these groups in establishing a dialogue with scientists, epidemiologists, Fiocruz, and all of these places that are being key in combating COVID. These were the spaces, advanced epidemiology centers, where the Brazilian response was articulated with the state that led to breaking patents and led to universal treatment for AIDS in Brazil, which is not the case in the United States. I don't know what AwinoOkech could tell us about other experiences in the world. So this is also another field in terms of addressing the questions by Anna and Wellington. What kind of local politics of care, what's going to happen in the post-pandemic era, and how these politics are then going to benefit more marginalized groups that we know are non-white groups in Brazil. I think these are the experiences of activism, also linked to health. There was the experience of the HIV/AIDS, and I've seen this now precisely at the moment in these movements about the high death rates for pregnant Black women, and also the recent experience of the feminist movement faced in Brazil in terms of the Zika epidemic that also was striking pregnant women. I see that emerging during the pandemics because we also need to think about the pandemics in these 15 months we've lived in now, several peaks. And I think that one of the peaks of mobilization is in terms of death rates for pregnant women. And I think Brazilian feminists has this experience of the Zika virus and our long experience in the struggles but for the decriminalization of abortion that then emerges as a paradox to the state that prevents us from choosing either having children when we want to and forces us to have the children we don't want to and to lose the children we would like to have in terms of because of care during the pandemic. So I believe that this is the type of strength and the type of strength of collective movements that we need to inspire ourselves in terms of advancing, in terms of these several movements gathering together in terms of LGBTQ issues and all and only feminist movements and only indigenous movement, because in terms of the biological dimension of this virus, it's going to strike us in different ways, but yet we should unite ourselves in this confrontation, bringing these contributions and what we have learned in other struggles and other historical moments, be it with the pandemics or in other struggles against the state, because our main struggle in Brazil is to struggle against this state. And I once again state that these movements in the Brazilian context, as a researcher, as an engaged scientist, I believe that this commitment from the university and in Brazilian science should intervene in social and political life. We cannot afford to only do research from other subjects. I had some French colleagues saying that this is tiresome to talk about COVID, and then I had to say, look, we cannot think about anything else than COVID, because this is the main anthropological, sociological issue in the country, and we cannot afford to talk about something else. We were talking about something else before, but now it needs to shift to being as focused on COVID. And Professor Okech, I would like to thank you for the possibility of establishing a dialogue with you. I would like to thank you, Felipe, for this opportunity, for being in this space, a space that I've always dreamt about being in here, and I'm very happy with this invitation. Thank you. Professor Miriam, before offering Professor Okech the space for her final remarks, I wanted to talk about the people who live with HIV/AIDS. And there's then this category HXH. These are men who have sex with other men, but who are married to women. And we have an increasing number of women who are heterosexual in stable relationships who are being infected by HIV/AIDS in light of these structural issues of heteropatriarchy. Professor Okech. There's actually an additional question about indigenous people in the parliament. We won't have time to address that, but since the 80s and the democratization, we have parliamentary members who are of indigenous origin and other leaders, but we don't have time to address those questions right now. Professor Okech, please.
Thank you. Thank you very much. And let me begin by thanking the organizers for the invitation to be part of this discussion, and to my fellow panelists, Miriam and Felipe, for the opportunity to converse. William, for your most generous moderation on the side, and Raquel for the enabling us to talk to each other across differences in language. I just wanted to make 3 points in closing. And these are connected to 2 significant things that happen on this day, 25th of May. Across the African continent today, we are celebrating what we call Africa Day. And it's an opportunity for us to think about our history as a continent that was created as a result of a series of colonial ventures, and the sort of collective future that we imagine for the African continent. Now, whether we are drawing on the roots of Pan-Africanism as a basis to think about that, or various other kinds of ideological structures, frameworks to think about our collective future of prosperity filled with freedom and justice. So there are a series of conversations happening in different platforms around Africa Day. But also, I think we all remember that a year ago today, many of us in different parts of the world were convulsed by the murder of George Floyd, which happened today, and which set off a series of conversations on the street, off the street, in legal spaces, in intellectual spaces, around the meaning of racism, but much more specifically, the question of anti-Blackness. And it is here where I want to end my closing remarks, which is to argue that, or to make the point that one of the reasons why it becomes very complex and difficult for many people to face up to the question of anti-Blackness as a very specific form of racism is the discomfort that it causes for people of color who are implicated in anti-Blackness as a way in which their own identities and their own way of traveling in the world has enabled. And this is where the distinctions and difficulties in holding each other accountable, in building solidarity as people of color often arise, because we find it difficult to create space for Black people to speak about how we experience racism, even at the hands of people of color. We find it difficult, people of color find it difficult to confront how they're implicated in sustaining and reproducing anti-Blackness in different ways in our societies. And until we stop being not complicit, but until we stop being precious about our ability to stop and listen and witness others' pain, others' experiences of exclusion and inequalities, the possibilities of meaningful transnational solidarity are never going to exist. And because those possibilities remain tenuous, one, because of different kinds of fragility, white fragility, people of color fragility, generalized fragility that is associated with class and gender positioning, autonomous spaces become important. And feminist movements have shown us for a very long time that the value of autonomous spaces is not around some fiction of homogeneity. When feminists create spaces to convene, to think together, let's not lie to each other that we are making the assumption that all feminists think alike and agree on everything. We don't. But there are fundamental shared principles that we agree upon. And in creating those autonomous spaces, we see those spaces as spaces to recharge, to rethink, to retool, to build our intellectual muscles that allow us to go out into the spaces where there isn't this shared analysis to do the work. If we talk about care, autonomous spaces are those spaces for care. Spaces where we do not have to explain our personhood. Spaces where we do not have to explain why a power analysis is important, why we need to complicate our thinking of gender. And so in drawing from that lesson from feminists around autonomous spaces, I offer this to the person who asked the question about thinking about Blackness in contexts that do not create space for that, is to find the spaces, those autonomous spaces, to build those communities, to recharge, to retool, because the reality of the world that we live in is that every time we step out of the spaces that we consider safe, the spaces of community, we are in battle. That's just the reality of the societies that we live in. And that we need to create multiple opportunities to steel us, to fortify us for the struggles that we are consistently waging every time we step outside those spaces of safety. The final point is to emphasize that the biggest takeaway for all of us, without a doubt, has been to demonstrate what transnational conversations can look like. From COVID-19, that's been the biggest takeaway. It has demonstrated what transnational conversations can look like without air tickets and without increasing our global footprint. And in building these transnational conversations using the virtual platform, which we all know continues to be unequal in different ways, but it has provided a starting point for forging some transnational conversations. I think that this is where the possibilities lie for building shared connections, for illustrating how connected our struggles are, irrespective of the context that we find ourselves in. And it's through this connection of the dots, by linking our global struggles, by linking to movements, intellectuals, and other movements that are situated in different contexts, struggling around the same issues, that I believe that the possibilities for beginning to dismantle, some of these great questions that we have been unable to dismantle because they're so connected to global power systems that we have been fighting in silos. That the minute we begin to connect our struggles together, we might begin to see the ways in which a blow is dealt to these systems of power. The Black Lives Matter movement showed us what was possible in the summer of last year. It brought institutions to a halt, to a place of reckoning around the things that they need to do differently. It connected communities globally around the experiences of racial injustice, policing, militarization, and carcerality across different parts of the world. We all saw how this impacted us in different ways in different parts of the world. Even though it was the death of one man among many men and women who've been Black men and women who've been dying in the US. And it is these catalysts of shared struggle that I would like us to hold on to as we continue to build platforms for transnational conversations. Because it is only by knowing each other, by understanding each other, that we can begin the process of finding each other to work together. Thank you very much.
Thank you, Professor. Thank you, Professor. I'm deeply touched by your lecture. Muito obrigada a todas.
Thank you so much to all of you who are here with us. Thank you, Professor Okech, Professor Grossi, Professor Fernandes, Professor De Souza, the Factory of Ideas team, the AG S9 team, and I would like to thank also the students who have been following us till this point. Thank you so much, and we'll be back on Thursday at 10 a.m. Brazil time for another debate on this cycle of lives. Have a wonderful day. Thank you.
Acabou.